Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Killian's triangle and Jenker's diverticulum. The inferior constrictor of the pharynx has two parts. The upper part is the thyropharyngeus, lower part is the cricopharyngeus. The pharynx has three constrictor muscles: superior constrictor, middle constrictor, and an inferior constrictor. The cricopharyngeus muscle, that is a part of the inferior constrictor, forms the upper esophageal sphincter and controls the passage of food into the esophagus. The cricopharyngeus muscle is further subdivided into an oblique part and a fundiform part. Between these two parts is an area of muscular weakness known as Killian's triangle. It is also called Killian's dehiscence. The weak spot at Killian's triangle may allow the mucosa of the hypopharynx to bulge outward as Zenker's diverticulum. Okay, so this is the inferior constrictor muscle, lower part, the cricopharyngeus part, and here is the Killian's triangle. This is the weak point, also called Killian's dehiscence. And if this is weak, then there may be chance of diverticular formation like this. Diverticular formation around this part of the cricopharyngeus. This is the fundiform part. So it may be very large size diverticulum. We call this diverticulum as Zenker's diverticulum. And it may be so large, it may compress the esophagus. Killian's triangle and Zenker's diverticulum, pathogenesis of Zenker's diverticulum, increase pressure during swallowing, especially if there is dysfunction of the cricopharyngeus muscle, can push the lining of the pharynx. Pharynx means hypopharynx here, outward at this point, leading to the formation of Zenker's diverticulum. Killian's dehiscence or triangle is of interest primarily because it is the anatomical point where Zenker's diverticulum originates. Symptoms of Zenker's diverticulum. This is particularly a disease of the elderly people, and we'll get these symptoms like dysphagia, difficulty swallowing, regurgitation of undigested food, coughing or choking, aspiration, that may lead to aspiration pneumonia, foul breath, we call it halitosis. Okay, we call it halitosis, foul breath. This is halitosis, and dysphagia, difficulty in swallowing. Okay, so we have also sensation of lump in the throat. There may be swelling, maybe little bit on the left side, and there is unintended weight loss because person cannot swallow food, cannot consume food, so he may eventually lose body weight. Diagnosis: Jenker's diverticulum is usually diagnosed through imaging studies such as barium meal X-ray, barium swallow X-ray, endoscopy, another way of diagnosis. Treatment is surgical. If it is a small diverticulum, surgeon give an incision to the cricopharyngeus muscle to relieve pressure. If it is large diverticulum, certainly the surgeon need endoscopic stapling or open surgery. And that's all about the Killian's triangle or Killian's dehiscence and Jenker's diverticulum. Killian's dehiscence or Killian's triangle is a part of the inferior constrictor of the pharynx, particularly it is a part of the cricopharyngeus part of the pharynx muscle. Pharynx has three muscles: superior constrictor, middle constrictor, inferior constrictor. Inferior constrictor muscle has two parts. One is thyropharyngeus, another is cricopharyngeus. We have weak point in the cricopharyngeus that is called Killian's triangle or Killian's dehiscence. And if there is more pressure and there is non-function of the cricopharyngeus, there is more pressure above, then there is chance of getting the Zenker's diverticulum, and this is usually seen after the age of 60. And that's all about the Killian's triangle or Killian's dehiscence and Zenker's diverticulum. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.